From the JAMA Network, this is JAMA Dermatology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Dermatology.
Hello and welcome to this author interview from the JAMA Network. This is Dr. Adamson, the web editor for JAMA Dermatology. Acne is a common chronic inflammatory disorder that is associated with low self-esteem, depression, anxiety, and in some cases, suicidality. Among transgender and gender-diverse individuals, acne can be a common occurrence, particularly for transgender men receiving testosterone therapy. In a new study in JAMA Dermatology, authors aim to explore the lived experience of acne and acne treatment in transgender and gender-diverse individuals. Dr. Howa Yeung is an assistant professor in the Department of Dermatology at Emory University in Atlanta, Georgia. He is the senior and corresponding author of this new study, and he is here to discuss this work. Welcome to the podcast, Dr. Yeung.
Thank you for having me, Dr. Adamson.
So I'm really excited that you're on the podcast. You're an associate editor at JAMA Dermatology as well, and this is the first time that we've had you on.
I know, I'm very excited.
So you do a lot of great work in a lot of different areas in dermatology. What is your clinical and research focus at Emory?
Both my clinical and research focus are on common skin diseases that affect LGBTQ populations, lesbian, gay, bisexual, transgender populations. I have previously studied skin cancer in gay and bisexual men and people living with HIV, and now my research and clinical expertise has focused on hormonal skin diseases in transgender individuals receiving gender-affirming therapy. So this is what I do on a clinical basis, and this is what I love to study.
So it seems like your then interaction with patients are what drives some of your curiosity and the questions that you ask as a researcher.
Absolutely. This was not a topic that was on most people's radar when I started this work, not that long ago, but certainly it has gained some traction in terms of understanding that this is an important population that we as a field should learn more about and that we can do better in terms of caring for hormonal skin diseases in this population.
And by this population, can you tell the listeners what you mean by this population for the study that we're going to discuss today?
I'm talking about transgender and gender diverse populations. And transgender and gender diverse individuals are those individuals whose sex assigned at birth differ from their gender identity. For example, a transgender man is someone who might be assigned female at birth and currently identifies as male. Some transgender men, for example, might receive testosterone as part of their gender-affirming care so that their body aligns better with their gender identity and to treat the dysphoria that is associated with this incongruence between their body and their gender identity. In that setting, where our patients are being treated with testosterone, perhaps not very unexpectedly, many of them might develop acne. And we don't know too much about how folks are experiencing acne and what challenges they might face when they are trying to seek care for their skin disease.
And as a clinician, did you have experiences with this population that kind of informed why you decided to do, say, a qualitative study or a mixed method study, actually, is what you did here, versus, say, a study that's only survey-based or a study that only, say, looks at, claims data? Why did you choose a mixed method study to better understand the experience of these patients?
I think a mixed method study is able to utilize the best part of what a quantitative study can provide and what a qualitative study can provide. A quantitative study is great when you know what questions to ask. And I think as dermatologists, we have great instruments to measure how severe someone's acne is, as well as what the quality of life impact that result from their acne might be. And so we have these awesome tools that I utilize to measure how much acne are our patients experiencing. However, I don't think we know all the pieces of the puzzle. There are a lot of issues that are beyond acne severity that impacts how someone experiences acne. And those are things that are hard to get at if we don't know what questions to ask to begin with. And so a qualitative study allows us to even begin addressing these questions by asking our patients, and more importantly, listening to our patients about what are the factors that make acne an important issue in their lives, and what are some important barriers that they have experienced when they're trying to seek treatment.
And so you decided to do this mixed method study where you combined interviews of patients that are transgender or gender diverse and have acne or have had acne of varying severities. How did you go about finding or recruiting patients? Because some folks might not even present to dermatologists. Maybe they might be seen in a clinic dedicated to transgender care, or perhaps under the care of another type of subspecialist, say an endocrinologist or a primary care physician. So how were you able to recruit patients, especially in a population that might not be as trusting in being involved in research?
Yeah, I think that's a great point. We did not limit our recruitment to dermatology offices. We actually mostly recruited from where people seek care from their provider. We actually recruited patients from different settings, including tertiary endocrinology referral center at the Emory Clinic, which is more of a private tertiary care hospital, as well as a public safety net hospital in Atlanta, where patients might be more underserved, patients might not have insurance, patients might have different socioeconomic barriers to care, because we want to capture the diversity of experiences that people have. We're not just trying to understand those who have great access to care, but we're trying to capture real-life scenarios where patients might face different barriers to care. So we decided to recruit from different settings so that we can potentially capture the diversity of people's experiences. While this might not be generalizable to everyone, for example, some patients might have no care at all, or they have so much barrier that they have difficulty seeking or receiving gender-affirming hormone therapy. So those folks are not represented, but we try our best to recruit a diverse set of patients.
In your study, you did semi-structured interviews where you designed an interview guide with a group of experts. You piloted with some patients as well, but you did something a little bit interesting where you included questions about iPledge, right? And iPledge is this system where clinicians and patients have to report pregnancies and pregnancy tests. And this can possibly present a challenge, particularly for trans men who were assigned female at birth and could potentially get pregnant. You wanted to expose them to the language in iPledge and kind of get their understanding. Is that a correct assessment? And why did you put that piece in your interview guide?
It was important for me to understand what transgender person's reaction to iPledge is like. We know that many transgender persons may face a lot of barriers to getting treatment for their moderate severe acne, for which isotretinoin is a very effective treatment, as you stated. But because of those barriers, many patients may not actually have experienced iPledge and experience isotretinoin treatment. The decision of whether one goes on isotretinoin necessarily involve you looking at the iPledge consent form and discussing that with the patient. So in our interview guide, we actually showed our patients what an iPledge consent form looked like, with specific focus on the discussion surrounding contraception, pregnancy testing, and mental health, so that we can understand from their perspective what their decision-making process is like and what they think about this iPledge process.
So you were able to find about 62 individuals that were eligible. At least you identified 62 eligible individuals, and 32 of them completed both the survey and the interview. What were the major kind of themes that came out of the discussions that you had with patients?
I think the first theme is that this is something that is very important to patients. Patients experience a lot of discrimination related to their acne, sometimes some social rejection, and a lot of patients actually anticipate some of these rejections so that they isolate themselves from interacting with other folks in order to prevent some of these cases of social rejection. I think it's really important for clinicians to understand how important this is. Acne is something that a lot of patients expect when they go on testosterone. In fact, some of our participants actually normalize the idea of developing acne as a good thing. They think that having acne is actually a sign that their testosterone is working, that masculinizing changes are coming. And that is really great for developing resilience against some of the negative effects of acne. But in that context, the way that normalization of acne in transgender people is framed as a trade-off. As in, this is a rite of passage for me. I have to go through this so that I get all the desirable effect of testosterone. But that's really not the case we know in real life. Acne is very treatable. While our patients are normalizing acne development, our clinicians are not doing a great job in normalizing acne treatment. And so I want some of the quotes that our patients have brought up to really facilitate the idea that acne is something that clinicians should bring up to their patients. A lot of our patients actually express even some fear when talking about their acne with their hormone provider. The last thing that they want is for their hormone providers to say that, oh, you're developing some side effects, negative side effects to your hormone therapy. So we might take your hormone therapy away, or so we might lower the dose of your testosterone to try to address this problem. Some patients actually feel like they've been dismissed when they talk about their acne. Most people have only resorted to using over-the-counter treatment and seeking advice from their family and friends or from online sources to really address their acne treatment education. I think clinicians have a much bigger role in terms of providing acne-specific education to our transgender patients so that we can address their concerns early, so that we can facilitate treatment to this very expected side effect of testosterone and overcome some of the barriers that they have identified.
I can understand this specifically for transgender men who are receiving testosterone, but what about transgender women? Is that also an issue, getting acne? What did you find?
It is intuitive that testosterone causes acne, so we almost expect that in transgender men. In the few transgender women that we discuss acne with, many of them actually reported higher level of quality of life impact than their transgender male counterparts. I think there are several issues that impacts that. Number one, like you mentioned, a lot of the feminizing hormone therapy actually treats acne. For example, estrogen preparations, as well as spironolactone and other anti-androgens that are commonly used, they are also what we would use to treat acne in cisgender women. But we also know that in cisgender women, when they receive treatment with oral contraceptive pills or with spironolactone, it doesn't mean all of their acne goes away. Many cisgender women still have acne. And so I think the impact of acne in transgender women has been almost dismissed in some way. And the differential impact that we see in cisgender women compared to cisgender men, we also see in transgender women versus transgender men. Although objectively, their acne that we have rated is not necessarily as severe compared to the testosterone-induced acne. The quality of life impact is very high. And we actually show from participants' experience, they think that having this acne flare on their face is really impactful and really negatively impact the gender expression as a transgender woman. It's difficult for people to put on makeup. They express higher level of gender expectation about what one's skin should look like. And so understanding how the differential impact of acne by gender identity is really something that's novel here in our transgender population.
So you found a lot of various different themes from all the patients that you interviewed in this study. I want to hear a little bit about the iPledge experience that you had participants explore in this mixed method study. What were some of their feelings around the iPledge system, the contraception, etc.?
When we showed the iPledge consent to our participants, many of them thought that it was very, very scary. The long list of side effects and the requirement for contraception, perhaps unsurprisingly to all of our participants with pregnancy potential, that is a huge deterrent. But there are some important take-home points here. For example, some of our participants think that because many of our participants have ongoing mental health care as part of their gender-affirming therapy, some people think that their existing mental health support make them more comfortable engaging in isotretinoin treatment. The contraception requirement is also very scary for a lot of folks, especially the requirement for contraception, many of them involves estrogen or progesterone, is quite concerning to many of our transgender men in particular. And so really it highlights why we need to engage our reproductive health specialist colleagues who are familiar in providing reproductive care for transgender and gender diverse individuals to really help patients navigate these choices and to overcome some of the myths surrounding contraception in transgender persons.
What would you say are a couple of take-homes that dermatologists in particular should take from your study?
The main thing is that dermatologists have a strong role in improving transgender healthcare. One of the main barriers that our participants have identified is that they have a very tough time finding clinicians who are familiar or even willing to learn about transgender healthcare. And so I think it behooves us as dermatologists to take a stronger role in terms of providing transgender-specific acne care to improve the skin health as well as the mental health of our patients who really can benefit from our expertise.
I'm Dr. Adamson, and I've been speaking with Dr. Howa Yeung about the lived experience of acne and acne treatment in transgender and gender diverse patients. You can find a link to the paper in this episode's description. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening. Catch you on the next episode of the JAMA Dermatology Podcast.